quick as I can, but also I want to make sure you all are educated on all the information that I do provide here. So hey, I'll go ahead and get started. Make sure I am set on time here too. I know United Healthcare, but hey, who cares? You all are with Ambetter. So all right. So a lot of you all may already know Ambetter, right? We've been here since 2013. The growth that we have seen over the years, right? We've grown over 5.5 million members. And that's just, through expansion and with the help of you brokers, right? Right now we are in about 29 states, still growing, still it's good to see, I'll say as a carrier, the stability, the growth and of us, and hey, we're not going anywhere. We continue to try to be consistent year to year, so that just says a lot there, right? Okay, so as of August 25th, the monthly low income special enrollment period has ended, right? So that means folks earning 150% or less of the FPL level are no longer be available or able to switch plans or issuers on a monthly basis. So this applies across all exchanges. So what does that mean for you? Clients who have taken advantage of that flexibility will now need to enroll during open enrollment. So don't wait until after open enrollment is over to reach out. These members will need your help before open enrollment ends. Now, if someone experiences a different qualifying life event, they may still be eligible for a special enrollment period and for the remainder of 2025 or 2026. But just to be clear, having a low income alone won't qualify anymore. So make sure this changes on your radar so your clients don't fall, through the cracks. And one important exception to this provision is it does not apply to federally recognized tribal members. Okay. The enhanced advanced premium tax credits are set to expire on December 31st, as we all know, which means they won't be available for 2026 health plans. So if you've been working with these credits, they help a lot of households lower the cost of their monthly premiums, especially those households earning over 400% of the FPL. Okay, with these enhanced credits going away, many members who relied on them will see a noticeable jump in their monthly premium. So that means there is a good chance that some members choose to go without coverage. So the Congressional Budget Office estimated that this change alone could result in, I think it's 4.2 million more members going without health insurance over the next decade. So it's important that your clients understand the importance of remaining covered. Okay. Now, just to clarify, traditional advanced premium tax credit for households earning between 100 and 400% of LPL are not going anywhere. This change only affects the enhanced version of those credits. So this shift could mean a lot more work, right, for you during open enrollment. Your clients will need help understanding what's changing and, why staying covered is still so important. And that isn't something you probably emphasize already, when talking to your clients, but it's going to be more important than ever. So start planning now. Many of your clients are going to need help finding affordable plans that still meet their needs. So just want to point that out. Okay, pay attention to these key dates for this upcoming enrollment period. If any of these deadlines are missed, it can mean a lack of vital coverage for, our members. So member communication, let's talk about it. So, prior to open enrollment, current members will receive renewal letters. So these letters are specific to the member's plan and the state. For any discontinued plans, the renewal letter will include the best similar plan for the member to auto renew. We will send renewal letters, for the member to auto renew. We will send renewal letters for discontinued plans that impact those members by the end of September. For all others, renewal letters will be sent by the end of October. And renewal letters will encourage action by December 15th to ensure an effective date of January 1st and no lapse in coverage. Okay, about the binder communication, it's a reminder to new members, to pay their binder payment, and just to ensure coverage will be in effect by January 1st, or the deadline for the effectuation, which is February 1st. Ambetter Health, we coordinated communication plan to, frequently remind these members via text, email, automatic calls, that the binder payment is due. So the urgency of the message, increases with time to encourage action until receipt of the binder payment or the deadline for the payment is reached. Okay. The member information package, they are distributed to new and renewal members whose binder or premium has been paid. They are sent out within approximately 7 days of the receipt of payment. So that's very important, getting that payment in. Some of the key information included in the member information package includes some of these things that you can see so you are aware what comes in the packet to your members. Okay, all Ambetter health members have access to virtual services through Teledoc Health. This includes 24/7 to medical professions via phone, video, any non-emergency medical issues, right? So this is easy way, fast care for those members in those outlying or, rural areas. So we can, they can help avoid those long wait times or in-person urgent care clinics and physician offices. Next here. So what I wanted to do, I know based on, brokers out there and selling, I wanted to focus on different states. So, first we're gonna go with Florida, but it was Florida, Georgia, and Texas that I wanted to cover just with the amount of time that we have. Okay, so here are some updates for Florida. Okay, so we are introducing two new plans. There's the Clarity Silver and the Thrive Silver. We also have the Enhanced Diabetes Care Silver that's going to be available. And then our Find a Provider tool has been redesigned to give you a more friendly experience. Don't forget about the Ambetter Health app where your members can download. We also have the Ambetter Health Solutions off exchange going to be available in Florida for 2026. In addition to that, members get 20% off of Walgreens and different wellness products. We got the My Health Pay, so just doing different activities where a member can earn up to $500. Yes, I said it, and we'll talk about that later. And better perks. So we all like perks, free stuff, discounts, all that stuff. So we got a lot of services within that. And then also, as I said before, is the virtual 24/7 care for our members. All right, this is the network highlights for Florida. This is only a partial list, okay? So you can always go to find a provider .ambetterhealth.com or you can go to guide.ambetterhealth.com, but it has been updated. But again, that's you can go to find a provider .ambetterhealth.com to look up in-network providers. But this is just a partial list for Florida and certain areas, counties that we have and in network still. Okay, let's talk about the Premier Portfolio highlights here, right? So the Ambetter Premier Portfolio is our broadest provider network. Okay, it's available in all Ambetter Health counties. With the Premier Portfolio plan, a member can visit any in-network provider with no referrals needed. In addition to that, members of the preferred Premier plan, can buy up adult vision and dental plans, and they can earn up to My Health Pay rewards, just doing different activities out there. In Florida, diabetes condition specific plans will be offered. I think one of the key words here is reciprocity. So, a member can cross state lines as long as that provider is in network. Okay, so our Premier network here is you can see all the Florida counties that the Premier plan is offered in. So pretty consistent, with our footprint. No expansions in 2026, but here's just a map out of those counties where the Premier is available. All right, moving on. So here our 2026 HMO Premier Plan offers is in 3 tiers. So we have the bronze, silver, and the gold. Keep in mind that the plan availability it does vary by the county. And we do have optional, vision and dental add-ons. Those are not will not be available on the Clarity or the Thrive Silver plans. So one of the plans, the Everyday Bronze, one of our continuing plans, which includes the co-pays for specialists, labs, and generic drugs here. I'm not going to go through each and every plan, but I just want to just highlight some of the ones that we still have for going into 2026 here. Okay. So with the enhanced diabetes care silver, got the $0 drug option plan. Members have access to extra benefits to help manage their diabetes. I'm sorry, and no extra cost, right? So this includes various things. So the $0 copays for the insulins, for cover medications used to treat diabetes, high blood pressure, cholesterol, mental health. We got $0 copays for the select diabetes supplies, so like the test strips, the insulin syringes. There's also the $0 copays for the labs. We do have care management, so to guide members the care that they need and support their health goals as well. Be sure to check the plan's formulary or have a member log into their online member account to view the full list of covered medications and supplies. So if you do want to learn more, you can visit our diabetes care page for helpful resources and support if need be. On here. Okay, so we have our Thrive Silver plan here. So this is the new plan that we introduced for 2026. This is our lowest cost silver plan option that's going to be available. So this goes as low as $0 on the 94% AV. And then for some of the our virtual 24/7 care is $0 across the board. And then we have our some of our RX drugs and urgent care going as low as $15 on this plan. All right. There's our other new plan, the Clarity Silver here. So, this is new. This is our lowest cost silver plan option where available. It's new for Florida. It is designed to be, very competitively priced, but with a little bit higher out of pocket costs on this. Okay. So our value portfolio, just want to highlight some things here. The Ambetter value portfolio, is a PCP centric portfolio, right? That's built around an exclusive provider network that is currently available in 11 counties in Florida. Reciprocity is available between the Ambetter value network in Florida and Texas. So with the value portfolio plan, members are assigned to a medical group and a PCP. So all the care must be, coordinated through the members assigned PCP, including referrals for the care and beyond the PCPs. The members can also request to change their assigned group or the PCP through the member portal, or they can go by contacting member services. There are referral exceptions for emergency care, urgent care, OBG, YN, and all that. But when scheduling appointments, a member should say they are an Ambetter value member, and to ensure the provider is part of the Ambetter value network. And then member of value portfolio plans, they can still earn to my health pay reward just by doing those various activities. And also just important note that the adult vision and dental biops are not available for the Florida value plans. Okay, so our value network coverage, just here the counties where we have our value and plans being offered in. Okay, so the 2026 value plan offers is in 3 tiers. So we have the bronze, silver, and gold. Does availability is vary by county, but again, the value plans do not offer dental or vision buy-ups. So Ambetter Health Solutions is a new off exchange plan for 2026. These plans are designed for our off exchange members purchasing health insurance through an ICRA. Solutions plan are currently offered in Georgia, Ohio, Indiana, Missouri, Mississippi, and South Carolina. In 2026, it is expanding into Arizona, Florida, Kansas, Nebraska, Tennessee, and Texas. So health solution plans offer members, in-person care with our broadest network, offering, healthcare providers and hospitals available. Members have reciprocity in all Ambetter Health service areas except California and New York. These are qualified plans that offer the same essential health benefits of our gold, silver, and bronze plans. There are even new platinum plans available in Georgia, Indiana, and Ohio. So the Ambetter Health Off Exchange that were previously offered have been discontinued. The member can enroll through, the EDE powered by Health Sherpa, or at, enroll.ambetterhealth.com, or, through an ICRA administrator. All right. So this is our the Ambetter Health Solutions portfolio offered in three tiers: the bronze, silver, and gold. So just want to give a snapshot of that, of what that looks like. Okay, transitioning on to Georgia. So let's see what's going on in Georgia. All right, so here's some updates on Georgia. Members get 20% off the Walgreens and wellness products, just like Florida. We have to go through the same thing we have just like the Florida state, but these are some of the things I cover. But it's really the same stuff as Florida, right? But also having that 20% off of the Walgreens, My Health Pays, and also the Ambetter Health Solutions off exchange plans being offered. All right, some network highlights, in Georgia. Just again, this is just a partial list, so feel free to go on our find a provider.ambetterhealth.com to look up any in-network providers for you. But just want to snapshot some of the these in-network providers that we do have on different selected networks here. So we have the Premier Network, and then we have the Select Network there as well. Okay, so here's our footprint just on our premier coverage where our premier plans are being offered in Georgia. Okay, our portfolio. So our portfolio here offers in three tiers. So this is the bronze, silver, and the gold. All right. So ongoing here is the everyday bronze. This everyday bronze has the co-pays for our PCP specialists and labs here. So here's our new clear silver with the $0 insulin options. So just starting in 2026, just want to let you know the Ambetter Health Premier plans provide members, managing diabetes with additional healthcare options and savings. Okay, so members on these plans will have, much lower out of cost for certain medications, supplies, and clinical support. Members of these plans may have access to $0 copays for preferred insulin and select medications used to manage their diabetes, high blood pressure, cholesterol, and their mental health. I mean, also, these plans also include a $0 copays on certain diabetic supplies and labs that can include like test strips or urine test strips, insulin syringes, pen needles, etc. All right, so this is our still plan that we have going forward is the Focus Silver. So this plan specifically has the $0 deductible, which is at the 87% and 94% AV levels. So some of the highlights here, our value portfolio is built around the exclusive provider network, available in 11 counties. Again, reciprocity, I always see that as a key word, to using that. Being sure with these, we know you have the prior authorization have to be obtained prior to, for any ad network provider. But just want to notate that with that, with the select network in Georgia, specifically does not have reciprocity with any other Ambetter select network. So just something to notate that there on a select portfolio. All right. So here's our coverage of what the select plans are being offered in. Okay, going here. So here's our select portfolio. So I think here is our select portfolios from Wellstar plus Select, St. Joseph, etc. We have our two tiers here. So we have the silver, and then there's the gold. Okay, so here's our standard silver plan. Going to 2026. This plan specifically have a $0 deductible, has a lower max out of pocket and copays, under the 94% AV. And if anyone don't know, I'm sure you know, but any labs that has AD is just after the deductible, so it's met. So just something to notate there. All right, a 2026 solutions coverage. Here you'll see all the Georgia counties that the solutions plan is offered in. So note, it is the same as the premier portfolio coverage. Okay. All right, so here is the Ambetter Health Solutions portfolio offered in, we got three tiers, but that's the bronze, silver, and gold. We will have the platinum plans, but only for the solutions off exchange portfolio. Okay. So I mean, it won't be a factor for the vast majority of you brokers, I imagine. But just wanted to let you all know that going into 2026. Okay. We're talking about Texas now. So some of the updates in Texas, we have the enhanced diabetes Kel Silver going to 2026. We are expanding into Midland County in 2026 as well. We have our Ambetter Health Solutions off exchange plans available. They get the same benefit of the 20% off the Walgreens. And then everything else falls into that health pays, perks, and virtual care. All right, here's a partial list out of Texas, some of the in-network providers that we do have in certain areas and counties. So you'll see some in bolded too, providers that's participating in the value network are those in the bolded font there. Okay, and here is our premier network where our premier plans are being offered in. And again, the expansion for 2026 is Midland County. All right, here's our portfolio for Premier. So we have our two tiers here. So there's the silver and the gold. And it does have vision and dental add-ons, if need be, that comes in a bundle. All right, here's the standard silver plan. This plan has a $0 deductible, max out of pocket under the 94% AV level. Then we have the enhanced diabetes Cal Silver, which is also $0 deductible, has a much lower max out of pocket for under the 94% AV. Then here's our value portfolio. Okay. Vision and dental add-ons. And for our two tiers, so we have the silver and the gold. And these are also on the focus and standard value silver as well. And here's where our value plans are being offered within these networks. And we do have a note there that it's not offering any value plans in the San Antonio area going into 2026. Here's our solutions network for Texas. So these are only 4 counties that we have our solutions plans being offered in. All right, here's our solutions portfolio. So we have our 3 tiers. There's the bronze, there's the silver, and there's the gold. Okay, so we have our adult vision add-on. So a good thing about this, no waiting period, right? So members have to be 19 years of age or older for these. Just make sure the providers are in network. Members can go ahead and get their routine eye exam or visit for $0 copay. We have our eyeglasses, lenses cover up to 100%, as well as various under the contact lenses too. Dental add-ons. So this is also no waiting period. There's a max benefit of $1,000 within the calendar year. Members also have to be 19 years age or older. Okay. $0 copay around the class 1. 50% you get more into the minor work on the class 2. And then as you get more into the major work on the class 3, there's 50% co-insurance. Wellness and rewards. So let's talk about it. So if I can just tell you, where there was a program out there where members can earn free money, save at the same time, do various things around it just to keep their health intact. And with that, they can use to pay their bills. We all got bills, right? So they can use those programs and points that they build to turn into dollars. So good thing about that is My Health Pays. So my Health Pays is our industry leading rewards program we use to promote wellness to our members' overall health. Okay, members can earn points by participating in fun and easy activities. These activities can include, just eating right, moving more, being well, and saving smart. As of today or last month, it was about 1.3 million downloads. Okay. So, it's still growth there, it's still opportunity. So, this is always a great selling point to let members know, especially with the changes that we are seeing, that hey, you can save money, you can earn up to $500, period, right? So here's some of the activities. So these points are earned by completing some clinical activities like annual physical as well as online activities, and to accrue those points. Your clients can earn up to $75 today by completing the first My Health Pays activity in as little as 15 minutes. That's all it takes. So, for example, points are earned by completing Pacific health screenings like annual wellness visit, preventative screenings such as breast cancer, and then men can earn points for cholesterol screenings, and all adults can earn points for just completing a blood pressure screening. So I think you're getting the bigger bang for your buck here, right? So some of the points uses, well, hey, what can I use it for? Your member have 2 options to redeem their points accrued, right? They can use the points they earn from activities to purchase directly from their online reward store with the My Health Pays catalog. Members can also convert those points earned into dollars to pay premium, other health related costs, and even selected monthly premiums. Like I said, we all got bills. So this is a good benefit to pay those off. To transfer to the funds, to money to pay premiums, bills, members must be using the Visa My Health Page prepaid card. So this is what that card looks like. Okay. So keep in mind that you can't just request it until those activities are completed. So once those activities are completed, then the member can go by requesting it online and it can have it sent to their mailing address. And make sure your members are using this to pay for qualifying bills at that. So I think it's good. Members would think they automatically get it, but it's like, hey, you got to do these activities first and then you can request it. So good to know. So year to date, I think this since I've been with Ambetter, I could just remember how low that number was. And now just going like, wow, close to 1 million. But let's look at some year-to-date statistics, regarding here, right? 850,000 health members and Better Health members had activated their My Health Pays accounts and continue to grow. Members collectively earn over 52 million in rewards. And those like myself who took advantage of this, who activate My Health Pays, are more likely to renew their coverage with Ambetter. So it's a great program that benefit, our members to and encourage all the members to apply. Okay. All right. What those perks are looking like. So and Better Health members receive perks and programs beyond health and wellness. So through Ambetter Perks, you also have members only deals on the goods and services that you use every day. So whether their car need maintenance, their dog needs some grooming, or you're planning a family vacation, Ambetter Perks have you covered. Here are just some of the few ways you can save. Like I said, home appliances, travel, entertainment, education. I mean, wow, it's so many various things here that members can take advantage of through our Ambetter Perks. So, how do you register? So members can go directly to ambetter.benefithub.com and they can simply just register there. Well-being program. So the Ambetter Stay Healthy Zone is a community of Ambetter members that facilitates connection, and support on various topics, including life changes, mental health being, stress tactics, nutrition, and a lot more. Find a provider. So a lot of you may know this already, right? Looking at providers, or you may go elsewhere. But again, need to find a provider and network. You go to find a provider .ambetterhealth.com. I believe you can still, well, actually, you can still go to guide.ambetterhealth.com, but I would just save this for, a link of yours, just save it. So it's just simply, you can go here. And like I said, it has been updated a bit to become a little bit more user friendly. So at this landing page, you'll go by hitting the search for a provider, and you'll go ahead and just follow the tools here. So you just put in city, county, or zip code. Make sure you select the right plan year, and then also just select the correct plan selection on whatever that is. So just make sure you do that. Now in the search bar box, you can either go by selecting some of these search by categories, or if you're looking for a provider name, or you have the NPI to make it easier, you can kind of just put there in the search bar. Now, if you're just using, it'll come up in different options below, so you can go by the specialty group. Kind of got to mess around with it if you are new, but it is a bit user friendly and more convenient for you when looking up providers. And then as they're going to give you information on how this look. So for example, for filtering in, or if you need to hit a provider, for example, I hit Stephenson here. It'll give me more information on that practitioner, the location, hours of operation, if they're accepting any new patients. I mean, also what languages they speak at that facility. All right, formulary and pharmacy. So if you are needing to find or locate the formulary list, okay, you can actually go to ambetterhealth.com. You can click the drug coverage for a members tab and then drug coverage. But you want to make sure also that you select the right state so you get the accurate information. It will take you on to here. So you will see that you will see the 2026 formulary list, which is also in different languages for you. It's quite a big list too. So what I'll do is I usually hit Control F. It comes up as a search box, and then you can go ahead and just put the medication there in the box. If it's not showing up, most time it's just not covered, but you may find some generic along the lines of that that may be still covered as well on the formulary. All right, prescription delivery. So we offer prescription delivery through Express Scripts Pharmacy Home Delivery. Eligible members may save when ordering a 90-day supply of medicine. Members will get maintenance medication delivered safely on their schedule to their door. So two easy ways to get started. Members can call their provider and ask them to send a 90-day prescription over, or your members can go ahead and to request a prescription delivery in their online member account. All right, broker portal. So I would say, I know we use different platforms out there, either, Health Sherpa, whatever. But you also have your Ambetter secure broker portal. Okay. If you need help with that, feel free to give our broker support a call. 855-700-7985 option 2. And then there's the URL. Save it. Broker.ambetterhealth.com. Take time to log in, see your book of business. All right, this is the home page. A lot of you already know this, but just a refresher for newer agents joining. This is the home page, so you'll see from your active members, delinquents, as well as your unpaid payments. Resources tab. I think some brokers miss this, but I think it's a great tool to have because we have a lot of good information there, from training, from marketing materials. Oh, also let me note too, if you ever need any Ambetter swag, I like to call it, like hand sanitizers, pens, things of that nature, stuff to pass out, let me know. You can go to me and say, hey Shondell, I need some Ambetter swag. I got this event coming up. I'll be happy to assist you. So on the resource page, you'll find some FAQs and links there for you, tutorials, information around that state specific for you if you sell in multiple states, social media guides. So it's a lot of information you can just have to take time to just look through there. You might have some questions and you may find in the FAQs. And again, if you need some Ambetter materials, feel free to reach out. So in your portal, you got a whole breakdown of the policy, different tabs here from, active, delinquents, unpaid, anything around the APTC and ICRA. If you have members that's on ICRA, it would show you that. If you need to export it, you can by hitting, it's all the way on your right side. You can export that too, if you need to, your book of business. All right. If you click on the policy, it'll give you all the details you need. So from the policy, the status, what plan that they're on, either they're active, their payments, all that stuff. And if they're on My Health page too, you can see where if that member is enrolled in My Health page or where they stand as well, in case that member has a question. Okay. Now, some tips and reminders, leverage your dashboard, during open enrollment so you can manage your reports. FAQs are in your portal and the resources sessions. Renewal letters. So those are going to be available on your broker portal during open enrollment. And keep in mind that the broker sales team support is here and available to answer any and all the questions that you have. All right, real quick, the member portal and mobile app. So, for those members that don't have an account, get them to make an account, they can find a lot of information there that they may come to you for, right, day by day. It's available at Ambetter, .ambetterhealth.com. All they got to do is create an account they need to, but they will have all the access that they need in their member portal. Now, the Ambetter Health mobile app, get your members to download this. This is much easier and secure for them to access all their health information. So anything around their account, their plan, billing, PCP, or if they need to change the PCP, or if they just got different questions, they can always, everybody's in their phone, right? So, hey, download this app and you'll see how easy it will be for you. Because I know with brokers out there, you're like the go-to-go person. They're reaching out to you for everything, but this makes it so much easier to just go ahead and simply just download that app. And contact us, right? If you don't know how to reach your account executive directly, like myself, I mean, I am your account rep. Call broker sales at 855-700-7985 and choose option 3. You can also call broker support there. They're option 2. But your account executive can help you with education, marketing, collateral, open enrollment planning, and much more. And if you need help with troubleshooting, commissions, password resets, and a lot more, you can contact broker sales support at that same number, but choose option 2. All right, coming to an end here. What should you be doing? All right, we have talked about a lot today, right? And I want to wrap things up by talking a little bit about what you should be doing. First, make a plan. This will not be a quote unquote normal open enrollment. Those of you who have done this for a long time might be thinking, has there ever been a normal open enrollment? And you're probably not wrong. It's always tough, right? But this year is going to be especially tough and you need to be ready. So make sure you're using the broker portal to stay in the loop. Second, your clients are going to have questions. So make sure you're connecting with them early and often. Be prepared to help your clients when they get a DMI request. Third, make sure all your clients have downloaded that Ambetter Health app. Okay, don't stop there. Make sure they log in and enable push notification as well. We've included a QR code on the screen that will take you to the Ambetter Health app on the Apple and Google stores. And finally, communicate with us here at Ambetter Health. Do you have questions, comments, concerns, or even feedback? We want to hear from you and value your insights and partnership. Make sure you're connected to your Ambetter Health account executive. All right, thank you for joining the training program here. All right, I'm not sure how much time I got on, but I did my best. I did my best.
You killed it. Nah, you killed it, Shondell. Really, we appreciate you. We appreciate you coming on. Honestly, this was great. A lot of good information. There are some questions if you got a little bit of time there. I've sifted through a lot of them, but there's a few questions in the Q&A if you wanna
Yeah,
run through that for a couple minutes with us.
yeah, absolutely.
So, and I'll kind of speed through some of them because I've also kind of set them up. But so Teladoc, is there a copay with Teladoc or anything? Is it just normal costs on the plan? How does that work?
Yeah, I mean, Teladoc is free. It's a virtual service out there. Members can take advantage of. So if they take advantage of it, they're really just getting a free service. Virtually. So that's the good thing about it. Teladoc, and we offering that in various of our states, so members don't have to worry about that, free of cost. Where do I get Tennessee information? Yeah, I mean, if you need any information around other states out there, we do have webinars coming up. So I think those links went out already. That we have webinar. If you can't make that webinar, just let me know. Reach out to me. Hey, Sean, I have some questions around this state. Just feel free to reach out to me directly. I'll be happy to, give you information around other states if you have questions. Where do they list the diabetic testing supplies that are covered? Okay, so those supplies, if it's not on our site on the ambetterhealth.com and then you can go to the diabetic site for the state. You can see if those supplies are covered. If not, you can check our formulary as well to see if those are coming up on the formulary too. If you're not locating that on the formulary, and you want to see if something else is not covered, just feel free to reach out to me. I don't want to stress you all about, certain stuff out there, but you should be able to see if it's on our site or our formulary. But again, if you come across any hiccups, just let me know, just reach out to me for sure. And I know some supplies out there too. You got to reach out to maybe member services as well to see if it is covered too. So it really depends. Is this for Ambetter Centene or Ambetter Absolute Total Care? So Ambetter is Centene is our umbrella, right? Ambetter is more so our popular ACA product. So we're all under one whole umbrella. So there's no differences there. Is an over 65 member that does not have enough work credits to enroll in Medicare able to enroll in one of the off-exchange plans. So over 65, I mean, obviously they should be enrolled in Medicare, so they won't be able to get on the off-exchange offerings with Ambetter for any reason. Are the health solutions plans only available for ICHRA participants? Not just for ICHRA. So our Ambetter Health Solutions is the off exchange, right? ICHRA is growing, right? It's growing. But we made it specifically for off exchange members, but also tailored to ICHRA people. That if you work with a lot with groups or with ICHRA, they have access, to that. The health solutions is more so for everyone, to be honest with you. If they don't have subsidy or anything, any member can get on it, to be honest. So if you have a member that want to go off exchange, feel free. So the premier plans in all states can be used across state lines, as long as the Ambetter exists in a specific state. And the plan, correct, Joe. That is correct. Premier is one of those selected networks where a member can cross state lines, reciprocity. And I mean, you get the bigger bang for your buck on the Premier plans, but I don't want to, disrupt the other selects like values and stuff. Yes, the value is a little bit more smaller network, I will say, but again, the Premier network gives members really the wide range of like, hey, I can go anywhere across the state as long as that provider is in network on our Premier plans. When it comes to quality measurements, are the clients need to send it into Ambetter to get the points? Yes, I mean everything that the member does, they can do that all from their member portal and they can follow that whole process. So that's how we really track the points and stuff like that. So if they want those to be accounted for, make sure you go through the member portal or download the Ambetter Health app. Like I said, like you'll literally be able to step by step on tackling those things and those points turning into dollars for you. Has there been an increase in PCP specialist network for 2026? Jose, that I am not sure. I can't tell you that, to be honest, really not sure. Hey, Shonda, what was the number again for broker member services? Oh, yeah. So for broker support, that number is Ambetter broker support, right? That's 855 700 7985. That's option 2, 855-700-7985, option 2. And then member services, you can actually, it varies by state, but you can go ambetterhealth.com and you can select the state. And then usually at the bottom of the screen, you will see the member services number. But let me know if you got questions, and need something. Do you know how to access help on demand? We're not sure. And I know that's through the marketplace, right? Where they have the help on demand leads and stuff like that. I'm really not sure how that process works. I thought that maybe you will have to go through that process and figure out what that looks like. But I do know it's just going through marketplace. They have something there where you can be part of help on demand and stuff get leads. I just can't tell you a lot about that because not real sure. Can you set up off exchange with Health Sherpa or only through Ambetter? Both. Health Sherpa is the same as Ambetter, so you don't have to just go through Ambetter. You can go through Health Sherpa or other platform, but or our side. It doesn't matter, but you still get the same benefit on both. Ambetter broker support. Yep, that's the number. That is the number. 8557. Yep, option 2. That's broker support. Yes. And then if a client lives in Illinois, can they use in Florida? Yes, they can. They can use in Florida. So again, if they Illinois, we just have Premier too. So as long as that provider is in network, that member can have reciprocity to go to other states. We do understand the snowbirds out there too, right? So that's the great thing too about reciprocity. Reciprocity. People love that, like, so I'm hoping that we can push that a lot more to put it out there so a lot more members know about that too moving forward.
Shondell, you're amazing, man.
Oh
Seriously, we
man, no,
love
you're amazing, man. Hey, I
no,
gotta say you got me pumped up already when the music was playing before everything started. I heard Michael Jackson in there. I'm like, oh man, yep.
yeah. Hey, that's awesome, man. Seriously, thank you so much for giving us your morning here. This was awesome. So everyone, this is Shondell Coleman Ambetter. If you need, in the Q&A is his contact information that was asked earlier. Again, we really appreciate you, man. Thank you so much for
Absolutely.
your time.
Thank you all. Thank you all.
We're going to take a 5-minute break here, 5-minute breather before we're going to pass it over to Todd here with UHC. So everybody take a quick 6-minute breather here, and we'll come back in at the turn of the hour. All right. Thanks again, Shondell.
You're welcome. Take care, everyone.